I'm Dr. Freddy Gomez, and this is MedTalk. According to the country's latest food consumption survey, a Filipino consumes an average of a little over 800 grams of food daily. The survey describes the typical Pinoy kind of diet, which includes rice, fish, and vegetables. These kinds of food are commonly known for its vitamins and energy-giving nutrients needed by a person to sustain a normal day. But wait! While many of us enjoy eating different food combinations daily, there is that possibility that for every food we eat, our body's immune system might overreact. Molecular inflammation or tissue inflammation is our body's response to fight harmful substances getting into our body, especially from the food we eat. But what makes it harmful to the body is when it releases excessive immune cells that damage our body and might lead to major diseases. Some of the health effects attributed to molecular inflammation are heart disease, cancer, and arthritis. Our guest for today is Dr. Theodore Achacoso. He's a nutritional medicine and anti-aging medicine specialist. For this episode, our topic is a little bit tricky. So hopefully with your expertise, you'll be able to tell our audience basically what is molecular inflammation. But before we talk about that, let's first talk about what is good health.
Yes, that's always been an issue of mine. As doctors, we say, well, you have to be healthy, but we really don't have any definition for health. So I devised a clinically actionable definition for health, something that you could keep with you each time you say, is my patient healthy? So health is actually as simple as A plus B plus C. So A is the absence of disease, which is the job of the illness medicine doctors to make sure that you're free of disease. B is the balance between anabolic processes or processes that make your body grow and catabolic processes, processes that destroy things in your body. According to C, the cycle of life of the organism. So when you're a pediatric case or you're a child, you have more anabolic processes going for you. When you're older, you have more catabolic. But in order to be of good health, you should be at the center of your anabolic and catabolic balance as an adult. So it means something that's very simple and yet profound. Just because you're not sick doesn't mean you're well. It only means that you're not sick.
Where would molecular inflammation come into play into this definition of your health?
See, when we were in medical school, inflammation was very simple. It was a very simple affair. It was either an acute inflammation, say you got pricked by a thorn, the body would come to the defense of the cells by putting in, you see it. It's a pus. It's coming out of the thorn prick and so on. That is a defense system of the body. It's acute. Then there's chronic inflammation, and here in the Philippines, the usual example of chronic inflammation is untreated tuberculosis, where you have continuous inflammation of the lungs. Just in the past few years, we now know that the body also produces substances that can inflame its own self. It's part of its natural functioning. At low levels, they are used to signal the body that it needs to defend itself, but at high levels, they can also destroy the body.
Your practice of medicine, which is home health optimization medicine, where does this focus on?
The health optimization medicine focuses on things that are happening inside the cell instead of what's happening in the organ. So what I do is I try to detect what's called the metabolome, or the metabolites that are inside the cell even before you get sick. Or if you're already sick, taking a look at what still are not functioning properly, try to balance them and see if that actually helps your illness medicine physician in your treatment. What happens is that they get better faster, or they need to titrate downwards their actual illness medicine medications. It's a new type of practice because the technology that allows us to look into the metabolites inside a cell has just been around for the past 20 years. and has not been aggressively used in the clinics until the last 5 years.
Okay. The typical understanding of people, Filipinos in general, is they only go to a doctor, they only go to a specialist when they feel something, when they're sick. But with home health optimization, you're sort of trying to preempt that. It's like trying to optimize a person's well-being to sort of prevent those diseases.
Exactly. It's mostly the detection of the imbalances that we're not really good at. See, the whole impetus for this is that Western medicine is really very good at acute stuff. You know, you get into trauma and it's perfect to be there. You get into acute sepsis or acute infections like appendicitis, it's perfect that you're there. But we, in allopathic medicine or Western medicine as we practice, have a very poor track record in curing chronic diseases like diabetes, obesity, cancers, and all of these things that plague us as we get older. Okay. So the question then becomes, why is that? And so we took a look inside. In the past 2 decades, we were taking a look inside the cell, and we now can detect all of these imbalances that are going inside the cell before the disease even manifests itself. Also, we have changed our lifestyle significantly such that all of these diseases have now escalated.
Who is the best candidate for this type of consultation? Is everyone pretty much going to be affected by inflammation at some stage in their life?
Generally, in my practice, I try not to accept clients who are younger than 30, because at age 30, everything starts to decline. And in fact, by around age 45, 46 or so, the batteries in your body, which are called mitochondria, they begin to fail. So, and you don't produce as much of them anymore. Okay. Unfortunately, newer studies show the severe imbalances even in our 21 to 30 cohort. And so we're looking at younger and younger people. But there are 2 kinds of patients who come and see. One is to be able to augment or complement whatever illness medicine is actually doing. And the second one are people who want some health optimization done to improve performance, like, for example, athletes. Okay. So these are the kinds of people that I see in my practice.
Okay. Next, Dr. Ted, let's talk about some of the diseases which this molecular inflammation may cause, and some of the symptoms that a person might feel that they might consider taking a look at this home health optimization medicine scenario. But before we do that, MedTalk will be right back. Stay tuned. Did you know there are foods that are considered anti-inflammatory? These include blueberries, apples, and green leafy vegetables that are naturally rich in antioxidants and polyphenols, a phytochemical found in plants. Drinking coffee may also protect a person from suffering inflammation, according to scientific studies. Welcome back to MedTalk, and still with us is Dr. Ted Achacoso. Dr. Ted, before the break, we sort of left off on the question, what are some of the common diseases which molecular inflammation causes, and what are some of the signs and symptoms that a person might feel?
It's something that's familiar to all of us. As we age, you know, we get bigger, our waist sizes get bigger. We are unable to manage our triglycerides, they go higher. Our HDL values get lower. And then we have also an increased propensity to cancer. And why is this? And the reason for that is your molecular inflammation. The other thing that molecular inflammation does, it actually leads also to diabetes, because you cannot control now the insulin balance in your body, and you have also what's called insulin resistance. Your cells don't like to use insulin because it cannot get in there. So these are all the sequela, or just the consequence of having molecular inflammation. Now, molecular inflammation is actually difficult to understand without the molecules itself. But think of it this way. Your body, as it works, it produces a lot of rust as a consequence of working. Now, the body is able to mop up all of those in order for you to be at good health. However, when you start abusing your body by eating highly inflammatory foods like French fries, or highly sweet foods like ice cream, for example, then the body cannot cope with production of too much of those toxic elements or toxic substances, or rust, and it will start rusting all other parts of your battery and ultimately your cell. Okay. So what happens at the time is that there are genes in your body that this rust would talk to, because the rust itself is not bad. It's an indicator to the body that it is performing its duties properly. Okay. However, if it's too much, it says, well, we cannot cope with this anymore, and it will signal you to produce more inflammation. Okay. And at the same time that there's rust, the rust is also a signal that your body should anti-inflame itself. We have mechanisms, and both of those are in balance all the time, unless you really push yourself with late nights out, drinking and partying too much, not sleeping. These are major things, very simple things that you can change, for example, to decrease your molecular inflammation.
The saying goes, whatever you do during your younger years, you sort of pay for it.
Yes, it does.
Yes, it does. As you grow older. But what's interesting to mention is, you mentioned how the body is very efficient. Whenever the rust is there, there are systems in the body to help combat that. But there comes a point, you said, that there comes a point when the body can't do it anymore. And is this at a certain age?
Ideally, ideally 21, I said 21 to 30, you should be perfect. However, we're finding that more and more, as people do texting at 2 o'clock in the morning, then we know that it's not working anymore. So the best thing to do is to test it, to test what your, like the body has what's called antioxidants, okay? And antioxidants are the things that you give to combat oxidative stress. Oxidative stress is the rust, okay? So antioxidants would combat them. But you don't want to give too much of antioxidants, because the body also still has to respond to inflammation in order to protect itself. So the best way to do it is actually to measure your levels before actually giving all of these supplements, like your vitamin A, C, E, lipoic acid, coenzyme Q10. These are all antioxidants that will help you, but not too much, because you will be unable to respond to inflammatory challenges later on if you give too much.
Are there subtle signs that a person might feel? Sometimes what I'm trying to get at is, a lot of people might think that being fatigued is normal because they work all day. But could there be subtle signs like that is a sign that our body is having trouble coping up?
Absolutely. The extra fatigue that you're feeling during the day is your incapacity to produce more energy. And the production of energy is like your battery, right? What's called the mitochondria inside your cells. You have about an average of 500 of those batteries all the time. Now, if you have molecular inflammation, what the system does is it decreases the synthesis of the parts of the mitochondria that can make them into full batteries. Another thing is that also overeating. If you eat too much, then you basically flood your battery with too much of what it turns into energy, and what happens is that it flows backwards, and then so even if you're eating so much food, you're still feeling a lot of fatigue during the day, because your battery is already full. And the best thing to do at that point in time is to actually exercise in order to use up some of that energy and pull it away, so that the excess food that you eat can be processed.
Okay. Now let's talk about a person that identifies, they want to find out if they have any if there's anything that could be done with their bodies to make it optimized to the fullest. What can they do? What are the tests that they can do?
There are several tests that you can do. First, you can actually test for your efficiency of the way you process macronutrients. Macronutrients are very simple. They're carbohydrates, proteins, and fats. There are only 3 of them. So you can take a look at the processing of your carbohydrate, for example, which is what is used as fuel by your mitochondria. So you can see how the body actually is breaking it down, and whether or not you lack cofactors to break it down. Aside from the testing the efficiency of the metabolism of your macronutrients, you can take a look at your micronutrient cofactors. Like, for example, your batteries will not function without vitamin B1, vitamin B2, B3, B5, the mineral magnesium, so lipoic acid. So these things have to get into the factory. So you can measure those levels and see whether or not you have enough to actually get that energy factory going and producing energy for you.
Okay, very well. And then next, let's talk about how to manage everything. Yeah, so we've identified some of the triggers, some of the symptoms. We've talked about how you could test it. Next, let's talk about how we could manage molecular inflammation. Before we do that, we have to pause again for a break. MedTalk will be right back. Stay tuned. Welcome back to MedTalk. Here are some myths and facts when we talk about inflammation. First, inflammation is a direct response of the immune system to battle out harmful substances in our body and protect tissues from any form of functional or metabolic stress. Second, some people are sensitive to the contents of grains. Example is gluten, which may cause allergy and can also lead to inflammation. And third, asthma is a disease caused by inflammation of the lungs. Stress and emotion can sometimes worsen asthma symptoms like fast and heavy breathing. And still with us is Dr. Ted Achacoso. Dr. Ted, so now let's talk about managing a person identified with molecular inflammation. How is this done?
Before you get to those diseases, there's an area that's imbalanced, and you try to detect those, not diagnose, detect those via science called clinical metabolomics. That's new science, and it's already used in the clinics right now. It's what I use to detect imbalances in your metabolome.
So that is available here in the Philippines?
Yes, it's available here. There are 4 areas that you want to address when you want to balance something. Okay. The first area, of course, are the genes. How do you influence the genes? There's a science called epigenetics, right? You influence the genes by, very simple, your food. You know, an anti-inflammatory food, for example, is broccoli. It is rich in sulforaphanes. It upregulates your anti-inflammatory system. Fatty foods that are rich in omega-3s and omega-6, they influence your genes, okay, you know, to upregulate the anti-inflammatory molecules in your body. You also want to influence what's called the symbionts in the body. Now, symbionts are those that are living with us, bacteria that are living with us. An example of those is the battery in your body is actually a bacterium. Right. Of course, there is what's called exposomics, or the environment. You want to remove the toxins that are in there. If you commute every day, you're in traffic and inhaling those gas fumes, you know, for several hours a day, then there's really nothing I can do but advise you not to do that, right? Because these are toxins in your environment. And then, of course, the other thing that you want to influence is the time. Okay, there are 2 aspects of time. One is called chronobiology, like your sleep, right, you know, the rhythms of your body. Lack of sleep, for example, can increase the inflammatory molecules in your body, and that's already known. And then, of course, the other one is evolutionary medicine, where you may want to go on a paleo diet because of that, those are probably more anti-inflammatory than the rest. Now, this is sort of like a protocol that you give to your client.
The purpose of all these foods to take in is to upregulate the anti-inflammatory.
Yes, and to downregulate the pro-inflammatory molecules inside your body. However, you can also take supplements. You measure, for example, you have what's called the antioxidant regeneration pathway. They're composed of vitamin A, vitamin C, vitamin E, alpha-lipoic acid, and coenzyme Q10. You can measure those levels and see whether or not you're deficient in any one of them. The other thing that you may want to look at is how much rusting is happening in your cell membranes, you know, as an indicator of how old or young you are. You know, when I was in training in Paris, it was the only test that we had for antioxidant stress. You know, if you were aging faster, then your cell membranes were actually getting rusted faster. Okay. So you give this only when you find these things. Because again, if you give them way ahead of time as a preventive without actually measuring, then you might be clobbering the defense mechanism of the body to do it. Yeah.
But you also mentioned, you know, I think, especially here in the Philippines, everyone is just bombarded by all these chemicals that causes the inflammation factors to go up and all that. But do you think there's a way to avoid all these stressors to the body, all these things that cause harm to the body? Or is it pretty much imperative for everyone to actually see if there's some molecular inflammation going on with themselves?
See, a lot of it is a lifestyle choice. For example, one of the things that is known to cause inflammation and contribute to your inflammation load is like food sensitivity. Okay, you get yourself tested for food sensitivities. I just had a client, for example, who tested sensitive for malt, and she loved beer. So, and could not take away the beer from. So these are choices that you have to make. You know, once you know what the results are, if you see that you're highly allergic to milk, for example, you have to take out dairy from your system. It's not that you take it out forever. You know, you train your body to, you don't take it every day. You know, that's just an example of, it does require a little bit of effort on your part to know that when you put in these things in your body, you're going to get highly inflamed. Okay. You know that when you're going to lack sleep tonight, tomorrow morning, you're not going to be at 100%.
Okay.
You know, but they don't want to hear this. So you have to make them feel better with supplementation right away. It doesn't, you know, it takes about 90 to 120 days for a single cycle, because that's when the blood cells actually replenish themselves. But it took a long time to get for you to get to this state, so it may take you several cycles before you actually start feeling better.
Okay. So Dr. Ted, just to reiterate, basically if someone has diabetes, they have heart disease and all this, this is not your line. There are other specialists to do that.
Yes.
Your line is basically to identify the stressors in the body, which is molecular inflammation, which may cause these diseases.
So if you're a physician dealing with a patient with diabetes, a patient with cancer, a patient with inflammatory bowel disease, and so on, these are different specialties in medicine. My goal is to get you to take a look at the metabolome or the metabolites inside the cell, which is contributing to that disease. Because you can treat how much you like with, you know, anti-diabetic drugs and so on, but if you don't downregulate your the genes that produce the inflammatory molecules, and if you don't upregulate the genes that are anti-inflammatory to the body, then you are just dealing with the signs and symptoms and treating them rather than taking a look at what's going on inside the cell.
All right. Do you have any advice for our viewers, final words?
There's a big movement to classify aging as a disease. So instead of saying that this is all part of aging, why not say, well, okay, there are simple things that I can do in order to have a good lifestyle. My advice is just usually three things. Eat well, sleep well, love well.
And there you go. With that, we'd like to thank our guest, Dr. Ted Achacoso, for joining us here on MedTalk. And I'm Dr. Freddy Gomez. Thank you for watching.